Ladies and gentlemen, your team UAMS starting lineup. Representing the College of Medicine, the only place in Arkansas where students can get a doctorate in medicine, Clint Aguiar. From the College of Nursing, the only program in the state that offers a PhD in nursing, Lana Brown. Bryant Phelan, from the state's only accredited College of Public Health. From the College of Pharmacy, whose Academy of Student Pharmacists chapter has been named Chapter of the Year a record 4 times, Dustin Ezell. Tanisa Kearney Ramos, representing the Graduate School, which offers advanced degrees affiliated with all 5 UAMS colleges. And from the College of Health Professions, where the state's only public physician assistant program resides, let's hear it for Courtney Mosley. At the University of Arkansas for Medical Sciences, you won't find a Razorback, a Trojan, a Lion, or even a Boll Weevil. Instead, what you'll find at UAMS are faces. The face of a future doctor who plans to deliver newborn babies. A pharmacy student learning the science behind preparing medications. Or a future researcher who may one day find a cure for cancer.
I chose UAMS to start my PA career because it's the only academic medical institution in the state of Arkansas. I wanted to stay in Arkansas and better the community that I grew up in. I do have a heart for rural medicine. I see the disparity and I feel like primary care and preventable medicine should be attainable and accessible to all Arkansans. Not many places do you see so many programs in such a small area and diameter to be able to mesh and bounce ideas off of each other. And once again, it's the prestigious reputation. I'm so proud to be able to call myself a UAMS student.
I chose UAMS because I saw that it was very involved in local communities, and a lot of the work that I wanted to do in the medical field was involving local communities and underserved communities. I would say UAMS is set apart because we are the center of research, medical research for Arkansas. When you have that kind of environment set up, it's the place where learning can do its best. You can do your best there. I want to pursue my PhD and actually want to be a professor in a college of public health, and I would love to return to UAMS.
I've never been around a group that was more committed to working with one another. And I think that comes from committed faculty. Getting students excited not only about learning things, but getting excited about being a part of your profession and standing out. I want to be able to retire someday and feel like the profession that I dedicated myself to is better for having me be a part of it.
These faces are just a few of the thousands that make up Team UAMS. This is where you'll find the future of healthcare.
My full-time position is an educator at UAMS College of Nursing, teaching in the master's program, Nursing Administration. I also work PRN in the Critical Care Division, and I'm a PhD student. The thing I've enjoyed the most is the support from my professors and support from the other healthcare team members within the organization. So I get to work with lots of other healthcare providers, physicians, other nurses, social workers, dietitians, physical therapy, occupational therapy, respiratory therapy. It's just the most amazing place to work where we all work together to provide the best care for the patients of Arkansas.
I chose UAMS because it's a local university and I'm kind of a ground-bound guy. I really love Arkansas. I've been here my entire life, born and raised. They've done a fantastic job of assembling this group of students, and we all work together. It's just been a great experience. UAMS has some wonderful tools. We've got simulation centers, we've got a clinical skills center, and you can tell that there's many, many people that teach us on a daily basis that care about us being successful.
And I got in contact with UAMS because I knew that they did a lot of really good research here, and immediately the dean of the graduate school put me in contact with who is now my advisor, Dr. Andrew James. What motivates me is the fact that women and African Americans are underrepresented in the biomedical sciences, and I feel that my personal research and my story can encourage other people or inspire other people. I think what sets UAMS apart is the attention to education and training. And it is a hospital inherently, but it's very much a medical university. And so what it means to me is that I'm getting the best type of training, the best type of education, when at a very early stage, that type of team and camaraderie and integration is being promoted. I have other friends that are graduate students elsewhere, and not a lot of people understand the concept of something so translational, and I don't think I would go anywhere else because I wouldn't get that type of training.
UAMS classrooms extend beyond four walls. Our patients determine our report card, and real-life scenarios serve as the best professors.
UAMS as a campus has beautiful educational facilities, but I think the most unique thing is that I have the privilege of running what I think of as the largest classroom on campus, and that's the hospital, because that's where the rubber meets the road. That's where our healthcare professionals really learn how to take care of patients. I think it's the world-class care that we're able to provide for patients and families that really puts us on the map. We offer specialized care here at UAMS that isn't available anywhere else in the state, and sometimes anywhere else in the country.
Education, research, and world-class care centered around the patient and family are all a part of what makes the state's only academic health center the place where medicine lives.
My name is Gail Ragland, and I've been coming to UAMS for almost 4 years. To me, they're just no better. I mean, I'm living proof. Now, I give God the credit, but He used the doctors, the trauma center, as you know, my life was at stake. I really am a team member, because anybody that I said, well, if you tried it, try UAMS, you know, that's the only place to be.
You won't find our student body doing the wave or calling the hogs. UAMS will never win a conference championship or have a Heisman Trophy winner. But our victories come in producing highly trained, family and patient-centered medical professionals committed to improving the health of all Arkansans today, tomorrow, and for years to come. Employees, patients and families, donors, supporters, volunteers, the Board of Trustees. We are all Team UAMS.